was a result of the muscles having tightened and shortened. The tightening had decreased the blood flow and therefore the supply of oxygen to the affected muscles. As a result, lactic acid built up, irritating the nerves that pass through the muscles. As the brain perceives pain as being located in the end organ reached by the affected nerve, the person felt vulvar pain. In addition, the irritation of the nerve typically gives rise to an inflammation that produces redness and swelling. And the redness and swelling, like the pain, show up in the endpoint organ reached by the irritated nerve, namely the vulva. Examining patients presenting with a complaint of pain in the vulva and with redness and swelling visible in the vulva, doctors would typically diagnose a vulvar infection, prescribing treatment that patients did not need for infections they did not have, treatments that were often irritating and sometimes harmful. Similarly, doctors often diagnosed prostatitis in men when the real issue was a pelvic floor disorder that could be addressed without drugs and without surgery. As compelling as the arguments of these far-sighted physical therapists were, what was really convincing was to see the profound and stunning results that Amy and the other physical therapists achieved when I began referring patients to them. I can describe those results in one simple but powerful word: cure. Through the modalities of physical therapy, manipulation, massage, and above all, exercises that patients could do on their own, women who had suffered chronic pain for years stopped suffering. This wasn't just temporary relief from pain. It wasn't a palliative. It was a cure. The women were able to give up the medications that had been controlling their pain, and they were able to return to normal functioning in every way, just by learning to relax and let go of the tension in their muscles, learning to lengthen their muscles, and learning to strengthen their muscles in the right way. The impact on my practice of finding this natural cure has been phenomenal. I estimate that today I refer at least 50% of my patients to Amy Stein and other physical therapists who specialize in the disorders of the pelvic floor. I could not be a vulvar specialist without their very important specialty. Many of the pain syndromes doctors and patients have struggled with for years now turn out to derive from myofascial disorders. For example, women are frequently diagnosed with irritable bowel syndrome or interstitial cystitis, when in fact all of their pain may be myofascial in origin. We live in a somewhat puritanical society where the issues of pelvic floor disorder are not discussed openly, if at all. What's more, our culture's attitude toward healthcare often encourages the quick fix: make an appointment and get a prescription. And certainly our current system of healthcare insurance favors such efficiency. In France, however, it has long been the custom for every woman who goes through a vaginal delivery to see a physical therapist as part of her postpartum treatment. The muscles are massaged, lengthened, stretched, and strengthened prophylactically so as to prevent the weakness that can lead to incontinence or the tightness that can result from a tear or episiotomy, and can lead to so much pain, discomfort, and limitations on functioning. We also tend to believe that there's so much healthcare information available in newspapers and magazines and all over the internet that we should be in charge of our own medical treatment, even to the point of self-diagnosis and self-medication. Studies show, however, that when a woman diagnoses herself with a yeast infection based on the symptoms of itching, burning, and discharge, to take a common example, she is incorrect more than 50% of the time. The symptoms are just as likely to be a result of nerve irritation or tightened tissue. Yet far too many women head to the drugstore for creams to treat